Magnesium deficiency, a comprehensive overview. Magnesium is a vital mineral involved in over 300 biochemical processes in the body. It is essential for the normal functioning of all systems, including the nervous, muscular, and cardiovascular systems. However, magnesium deficiency is a serious issue affecting millions of people worldwide. This detailed article will explore the causes of magnesium deficiency, its symptoms, diagnosis, recommended dietary intake, and best sources of magnesium. We will also discuss strategies for correcting magnesium deficiency and its impact on health. Causes of magnesium deficiency. 1. Inadequate dietary intake. In modern society, many people consume insufficient amounts of magnesium-rich foods. This is primarily due to a high intake of processed and refined foods, which are low in magnesium compared to whole foods. Foods rich in magnesium, such as nuts, seeds, leafy green vegetables, and whole grains, are often replaced with high sugar and high fat products that do not provide adequate magnesium. 2. Absorption issues. Certain medical conditions can impair the absorption of magnesium. For example, inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, can disrupt magnesium absorption in the small intestine. Kidney diseases can also affect magnesium balance, as kidneys play a crucial role in regulating its levels. Other conditions, such as celiac disease, can lead to impaired absorption of magnesium due to damage to the intestinal lining. 3. Excessive caffeine and alcohol consumption. Caffeine, found in coffee, tea, and energy drinks, has a diuretic effect, which can increase magnesium loss through urine. Alcohol, especially in large amounts, can also contribute to magnesium loss by disrupting the balance of minerals in the body and impairing kidney function. Chronic consumption of these substances can lead to critically low levels of magnesium. Chronic stress ***. Stress can impact magnesium levels through several mechanisms. First, during stress, the body consumes more magnesium to produce energy and combat elevated cortisol levels. Second, stress can increase magnesium excretion through urine. Chronic emotional and physical stress can contribute to magnesium deficiency and disrupt its absorption. 5. Uncontrolled use of medications. Certain medications can influence magnesium levels in the body. Diuretics, especially those used to treat hypertension and edema, can increase magnesium loss through urine. Antibiotics and diabetes medications can also alter magnesium levels by affecting its absorption or excretion. 6. Poor nutrition. High calcium intake without adequate magnesium consumption can disrupt the balance between these two minerals. High consumption of dairy products and calcium supplements can lower magnesium levels. Additionally, inadequate water intake and consumption of magnesium-rich foods such as green vegetables and nuts can contribute to deficiency. Signs and symptoms of magnesium deficiency. 1. Muscle cramps and spasms. Magnesium plays a crucial role in regulating muscle contraction and relaxation. A lack of magnesium can lead to painful cramps, spasms, and muscle stiffness. Cramps may be particularly pronounced at night and can interfere with sleep quality. 2. Chronic fatigue and weakness. Magnesium is essential for the production of adenosine triphosphate, ATP, a molecule that serves as an energy source for cells. Magnesium deficiency can lower ATP levels, leading to overall fatigue, weakness, and reduced energy levels. This can impact productivity and general activity levels. 3. Migraines and headaches. Magnesium is involved in regulating neurotransmitters and vascular tone. A deficiency in magnesium can contribute to the frequency and intensity of migraines and headaches by impairing the body's ability to regulate nerve and vascular functions. 4. Mood problems and mental health issues. Magnesium affects brain chemistry and serotonin levels, a hormone that regulates mood. Magnesium deficiency can lead to anxiety, depression, and irritability. Individuals with magnesium deficiency may experience emotional swings and difficulty managing their mood. 5. Irregular heartbeat and cardiovascular problems. Magnesium is crucial for maintaining normal heart rhythm and function. A deficiency can cause arrhythmias, palpitations, and other heart rhythm disturbances. In severe cases, magnesium deficiency may increase the risk of cardiovascular diseases. 6. Osteoporosis and bone health issues. Magnesium plays a key role in maintaining bone mass and density. A deficiency can disrupt bone mineralization processes, leading to osteoporosis, reduced bone density, and an increased risk of fractures. 7. Concentration and memory issues. Magnesium is involved in maintaining cognitive functions and neuroplasticity. A lack of magnesium can impair concentration, memory, and mental clarity, affecting learning abilities and cognitive performance. 8. Insomnia and sleep disturbances. Magnesium helps regulate melatonin levels, a hormone that controls sleep-wake cycles. Deficiency in magnesium can disrupt sleep quality, leading to insomnia and difficulties falling asleep. Diagnosis of magnesium deficiency. 1. Blood tests. The most common method for diagnosing magnesium deficiency is measuring serum magnesium levels. However, this method is not always accurate because only 1% of the body's magnesium is found in the blood, while most is stored in bones and tissues. Normal blood levels may not always reflect overall magnesium status. 2. Urine tests. Measuring magnesium levels in urine can help assess kidney function and magnesium excretion. Changes in urinary magnesium levels can indicate absorption issues or magnesium loss. 3. Diet and nutrition assessment. Evaluating dietary intake can help identify magnesium deficiencies in the diet. A dietitian or healthcare provider can analyze daily food consumption to determine if magnesium intake is adequate. 4. Clinical evaluation and symptoms. A healthcare provider can assess symptoms and signs of magnesium deficiency, such as muscle cramps, fatigue, and mood problems, to make a preliminary diagnosis and recommend further tests. Recommended dietary allowance, RDA, for magnesium. The recommended daily intake of magnesium varies based on age, gender, and physiological condition. Men, ages 19 to 30, 400 to 420 mg per day. Ages 31 and older, 420 mg per day. Women, ages 19 to 30, 310 to 320 mg per day. Ages 31 and older, 320 mg per day. Pregnant and lactating women, pregnant, 350 to 360 mg per day. Lactating, 310 to 320 mg per day. When planning your diet and magnesium intake, it's important to consider not only the recommended daily amounts but also individual needs based on factors like physical activity levels, health status, and other variables. Best sources of magnesium. 1. Nuts and seeds. Nuts and seeds are among the most concentrated sources of magnesium. For example, almonds. 100 g of almonds contain approximately 270 mg of magnesium, about 68% of the RDA for adults. Cashews. 100 g of cashews contain around 292 mg of magnesium, 73% of the RDA. Pumpkin seeds. 100 g of pumpkin seeds contain about 262 mg of magnesium, 65% of the RDA. Sunflower seeds. 100 g of sunflower seeds contain around 325 mg of magnesium, 81% of the RDA. 2. Leafy green vegetables. Leafy green vegetables are excellent sources of magnesium and other nutrients. Spinach. 100 g of fresh spinach contains approximately 79 mg of magnesium, 20% of the RDA. Cooked spinach contains even more magnesium per 100 g, up to 87 mg. Swiss chard. 100 g of Swiss chard contains around 81 mg of magnesium, 20% of the RDA. Kale. 100 g of kale contains about 33 mg of magnesium, 8% of the RDA, though this amount may increase when cooked. 3. Whole grains. Whole grains are good sources of magnesium as they retain the bran and germ. Oats. 100 g of oats contain about 177 mg of magnesium, 45% of the RDA. Quinoa. 100 g of cooked quinoa contains approximately 64 mg of magnesium, 16% of the RDA. 4. Legumes. Legumes are an important source of magnesium and other macro and micronutrients. Lentils. 100 g of lentils contain about 36 mg of magnesium, 9% of the RDA. Beans. 100 g of beans contain approximately 70 mg of magnesium, 18% of the RDA. Chickpeas. 100 g of cooked chickpeas contain around 48 mg of magnesium, 12% of the RDA. 5. Fish. Certain types of fish contain magnesium, making them a valuable addition to the diet. Salmon. 100 g of salmon contains about 37 mg of magnesium, 9% of the RDA. Tuna. 100 g of canned tuna contains around 64 mg of magnesium, 16% of the RDA. 6. Avocado. Avocado not only provides magnesium but also contains healthy fats and vitamins. Avocado. 100 g of avocado contains about 29 mg of magnesium, 7% of the RDA. 7. Dark chocolate. Dark chocolate with high cocoa content can be an excellent source of magnesium. Dark chocolate, 70 to 85% cocoa. 100 g of such chocolate contains about 228 mg of magnesium, 57% of the RDA. 8. Bananas. While not as rich in magnesium as other sources, bananas are still a good option. Bananas. One medium banana contains approximately 32 mg of magnesium, 8% of the RDA. 9. Seaweed. Some seaweeds, like nori and agar-agar, contain significant amounts of magnesium. Seaweed. 100 g of dried seaweed contains around 800 mg of magnesium, 200% of the RDA, though it is usually consumed in smaller quantities. 10. Dairy products. Dairy products, while not the richest source of magnesium, can still contribute to overall intake. Yogurt. 100 g of plain yogurt contains about 12 mg of magnesium, 3% of the RDA. Milk. 100 g of milk contains around 10 mg of magnesium, 2.5% of the RDA. Strategies for increasing magnesium levels. 1. Varied diet. Include a variety of magnesium-rich foods in your diet. Plan meals to include nuts, seeds, leafy greens, whole grains, and legumes daily. This will help ensure a consistent intake of magnesium and maintain optimal levels in the body. 2. Avoid processed foods. Try to reduce the consumption of processed and refined foods, which often have low magnesium content. Instead, focus on natural and whole foods. 3. Hydration and electrolyte balance. Drink enough water and maintain electrolyte balance, as dehydration and imbalances can affect magnesium levels. This is especially important during high physical activity and in hot weather. 4. Control caffeine and alcohol intake. Reduce consumption of coffee and alcoholic beverages, which can contribute to magnesium loss from the body. If complete avoidance is not possible, compensate by increasing magnesium-rich foods. 5. Review medication use. If you are taking medications that may affect magnesium levels, discuss with your healthcare provider the possibility of adjusting the treatment or adding magnesium supplements if necessary. 6. Magnesium supplements. In cases of significant magnesium deficiency, supplements may be required. Various forms of magnesium supplements are available, such as magnesium citrate, magnesium oxide, and magnesium glycinate. It's important to choose a supplement that is well absorbed and causes the least side effects. Consult with a healthcare provider before starting any supplements. Conclusion. Maintaining optimal magnesium levels is crucial for overall health and the prevention of numerous conditions. A varied diet that includes magnesium-rich foods can significantly aid in maintaining normal magnesium levels and preventing deficiency-related issues. If you experience symptoms of magnesium deficiency or suspect that your intake is inadequate, seek medical advice for diagnosis and correction.